Are there going to be people in this country who don't get a ventilator if they need one? Are you concerned that the actual physical equipment that is needed to serve the people who will get sick is out there? Can you reassure everyone tonight that there is not a shortage of ventilators or ICU units?
And that's why the president has taken such bold and decisive action, right?
That's Seema Verma, the administrator for Centers for Medicare and Medicaid Services, meaning she oversees America's national health insurance program and works with state governments to administer subsidized health care for low-income earners. You've probably seen her in the background of every Trump press conference regarding COVID-19. That's because in March, she was appointed to Trump's coronavirus task force. So how did she land this dream job of staring at the president's back? Let's find out. I'm PJ Evans, and this is a story about Seema Verma. She was born in 1970 in Portsmouth, Virginia, the same birthplace as Missy Elliott. There must have been something in the water, because Verma would too get her freak on in the form of rejecting her family's politics. Her father, Yugal Verma, said, "She grew up in a Democratic household. I am a staunch Democrat." After graduating from Johns Hopkins University with a master's degree in public health, Verma was on her way to tackling health policy in the country. In 2001, she founded the health policy consulting firm SVC. She worked with Republican governors in Indiana like Mitch Daniels and Mike Pence on Medicaid measures. Verma would later take advantage of a provision in the Social Security Act that gives states wiggle room to implement an alternative plan that would still further the objective of Medicaid, which is to provide health care to poor people. In Indiana, she teamed up with Mike Pence to put in place an expansion program called Healthy Indiana Plan 2.0. It expanded Medicaid to childless adults, but it in turn put many low-income folks at risk. Physicians for a National Health Care Program wrote, "Her plan forced impoverished Medicaid enrollees to pay dearly for care, imposing unprecedented co-payments and premiums on people with little chance of affording them. Those who miss a payment are denied coverage." It was punitive. If people failed to pay their premiums, they could be without health insurance for up to 6 months, which seems needlessly cruel. Verma's company also consulted on the Medicaid expansion provision of other red states like Kentucky. It required people to engage in work activity for a specific number of hours each week. According to the waiver, able-bodied adults under 64 years of age would have to take part in things like unpaid volunteer work, employment, or job searching in order to receive health insurance. Studies have shown that work requirements, like Verma's, result in greater losses of health insurance and disproportionately affect veterans and minorities. With this record, naturally, Verma was tapped by a thrice-married former game show host who's been accused of rape to head up the Centers for Medicare and Medicaid Services, or CMS, in March of 2017.
Our footprint on the United States healthcare system is so significant that everything we do has a large ripple effect on every American.
Verma's agency has a budget of $1 trillion a year and oversees 130 million Americans' health insurance plans and many of the provisions her former company consulted on. She recused herself from issues with every state she worked with while at SVC: Arkansas, Kentucky, Indiana, Iowa, Ohio, South Carolina, and Virginia. Her office gave permission to most of these states to implement work requirements in order to receive benefits like Medicaid. A year after her appointment, Verma made a speech in San Francisco where she berated the concept of Medicare For All, which would provide every American free health care as a right.
Ideas like Medicare for All would only serve to hurt and divert focus from seniors, all the while expanding the regulatory burden and the misaligned and perverse incentives of a government-run system. In essence, Medicare for All would become Medicare for none.
Later that year, Verma tweeted, "This year's scariest Halloween costume goes to," along with a photo of someone wearing a Medicare For All shirt. She followed up in another tweet, "Did I get your attention? Good. Medicare For All isn't a joke. It's a multi-trillion-dollar drain on the American economy that will bankrupt future generations. It's a government-controlled healthcare that will strip choice away from millions. It's a bad idea, and it is scary. Her repeated attacks on the concept of giving free healthcare to every person as a right ended up costing her a complaint, alleging she violated the Hatch Act, which forbids most executive branch employees from taking part in political activities. However, the Office of Special Counsel quickly shot it down and found Verma not to be in violation of the act. She may hate free healthcare, but she has a record of asking for taxpayer dollars for pretty much everything else. While she was giving that speech about how bad free healthcare is, she had all of her jewelry stolen from her luggage in a parked SUV. She immediately sought to have taxpayers cough up $47,000 for her stolen jewelry, which allegedly included a $5,900 Ivanka Trump branded pendant and $325 moisturizer. It's almost like she wanted to have people pay for something totally random and bad that happened to her. The Federal Health Department reimbursed Verma $2,852.40 of the $47,000 she sought, which could buy her at least 3 jars of her ridiculously expensive moisturizer, probably. But this wasn't the last time she'd get herself in contentious territory with taxpayer dollars. Months later, in 2019, Politico notes Verma quietly directed millions of taxpayer dollars in contracts to Republican communications consultants during her tenure atop the agency, including hiring one well-connected GOP media advisor to bolster her public profile. Verma approved $3 million of federal funds on paying these communications consultants and other PR initiatives to burnish her public image. Federal health officials worked closely with consultants to try and get Verma into magazines like Glamour. In emails obtained by Politico, the consultants recommended that CMS lobby key women's leadership and general interest magazines for potential interview/profiles. Verma denied she was using taxpayer money for publicity purposes, which would be illegal. She said she was only contacting consultants, quote, to promote the programs that we have in place, unquote. It's unclear if Glamour magazine has been on the forefront of American healthcare issues in the past. Verma, who is on Trump's coronavirus task force, is now in the spotlight as a novel coronavirus that causes a disease dubbed COVID-19 sweeps the country. As of March 31st, there have been over 180,000 confirmed cases in the US and over 3,500 deaths as a result. Verma and the Trump administration are now doing a complete 180, reversing course and asking the hospitals and systems they have long been going to war with for some help. Although a recent Trump proposal, released at the beginning of the coronavirus outbreak, did ask for disaster medical systems and emergency operations, it sought an $18 million cut to the hospital preparedness program. In light of COVID-19, Politico notes, the same government that sought to cut pay rates and layer on new regulations is relying on hospitals as the nation's chief defense against the pandemic. Verma is on the front line of controlling the pandemic and approving funds for the hospitals to control it. There are only 100,000 ICU beds across the country, and so far, it hasn't always been easy to get Verma to be completely transparent about the state of America's necessary supplies.
You're confident that if we had a huge uptick in the need for that specific piece of equipment that we could get new ventilators into ICU units quickly?
You know, Tucker, I don't want to make drastic predictions here, right? Because this situation is changing every single day. And based on the information we have, we know that we have to be aggressive.
When Trump declared the U.S. a state of emergency, states were able to expand Medicaid to low-income people so they can get treatment and tests for the virus without all the red tape Verma worked so hard to keep in place. If only Verma cared about uninsured people as much as she cares about uninsured, tacky jewelry.
Hey, thanks for watching Who Is? Did you know we have a podcast now too? On Who Is, the podcast, I'll dive deep into the fascinating lives of the people who run things, whose decisions impact every aspect of our lives. How did they get where they are today? And knowing that, what might they do next? From politicians to the ultra-rich, to military contractors and monarchs and media moguls, I'll introduce you to the reporters and experts who know these real-life world molders best. Sharp-eyed observers and confidants who observe our subjects as they make the decisions that define our everyday lives. To see more, hit the link or search Who Is on the iHeartRadio app or wherever you get your podcasts. And for more of the video series you know and love, be sure to check out the Snapchat versions and our series playlists on YouTube and Facebook.